Hello, I'm Christopher Voss, MD, MS, a Harvard and Stanford University-trained board-certified physician in anesthesiology, critical care medicine, and neurocritical care medicine. In this educational video, we will tackle a critical question for ICU healthcare providers. Should I start nutrition on my ICU patient, and if so, when, how, and what? Providing proper nutrition to critically ill patients is an essential part of care, but it requires careful consideration of the timing, method, and type of nutrition, especially in patients with varying health and nutritional statuses. Today, we will review the latest evidence and guidelines to help you make informed decisions for your patients. The decision to initiate nutrition support in critically ill patients depends on multiple factors, including the patient's pre-ICU nutritional status, clinical condition, and prognosis. For patients at low nutritional risk, previously well-nourished and without signs of malnutrition, nutrition support can be delayed for up to 7 days. According to ASPEN and SCCM guidelines, it is safe to withhold nutrition in this group during the first week of critical illness, provided they are receiving adequate fluids and electrolytes. For patients at high nutritional risk or those with signs of malnutrition, early nutrition, preferably enteral nutrition, should be initiated within 24 to 48 hours if they are hemodynamically stable and the gastrointestinal tract is functional. When to start nutrition? Early versus delayed nutrition. Early enteral nutrition is recommended within the first 24 to 48 hours of ICU admission in patients who are at high nutritional risk or already malnourished. Delayed nutrition, up to 7 days, is acceptable in low-risk, well-nourished patients who are expected to resume oral intake soon. In these patients, waiting to start nutrition can help avoid complications such as overfeeding and metabolic disturbances. Guidelines for timing. In mechanically ventilated patients, early enteral nutrition is recommended within 24 to 48 hours if the patient is hemodynamically stable. For patients who cannot receive enteral nutrition due to GI tract dysfunction, parenteral nutrition should only be considered after 7 days if the patient is well-nourished and not at high risk. However, in high-risk patients, parenteral nutrition may be started earlier. How to start nutrition? Enteral nutrition. Route. A nasogastric or nasojejunal feeding tube is typically used for enteral feeding in the ICU. Feeding rate. Start at a low rate of 10 to 20 milliliters per hour and increase gradually as tolerated. Monitoring. Watch for signs of intolerance such as gastric residual volumes, vomiting, or diarrhea. Adjust feeding accordingly. Parenteral nutrition. If enteral feeding is not possible, parenteral nutrition may be administered via a central venous catheter. Start cautiously in patients at risk of refeeding syndrome and monitor closely for complications like hyperglycemia and infection. What type of nutrition should be given? Enteral nutrition. Standard formulas are suitable for most patients, providing around 1 to 1.5 kilocalories per milliliter. Specialized formulas may be used in certain situations, high-protein formulas for trauma or burn patients, or low-carbohydrate formulas for those with respiratory failure. Parenteral nutrition, composed of amino acids, lipids, glucose, vitamins, and trace elements tailored to the patient's needs. Avoid overfeeding to reduce the risk of metabolic complications, particularly in the early stages of critical illness. In summary, 1. For low-risk, well-nourished patients, you can safely withhold nutrition for up to 7 days. 2. For high-risk or malnourished patients, start early enteral nutrition within 24 to 48 hours if possible. 3. Closely monitor patients for signs of feeding intolerance or complications and adjust nutrition based on their clinical condition. Providing the right nutrition at the right time plays a critical role in improving outcomes for ICU patients. By following these guidelines, you can optimize patient recovery and minimize potential risks. To learn more about critical care medicine, please visit us on our website at medspecialists.net and subscribe to our YouTube channel.